After welcoming your little one, you have likely focused on your baby, but understanding your own recovery, especially your C-section scar, is truly important. Knowing about your incision type is key for your healing journey and any future pregnancy plans. When we talk about C-section incision types, we are primarily referring to the incision made on your uterus, not just the skin incision you see. The two main types are the low transverse uterine incision and the classical vertical uterine incision. The low transverse incision is the most common type used today, often called a bikini cut because it is a horizontal cut across the lower part of the uterus. This type is preferred because the lower uterine segment is thinner and contracts less during labor, leading to less bleeding and a stronger scar. A classical vertical incision, on the other hand, is a cut made vertically on the upper part of the uterus, which is thicker and contracts more vigorously. This older method carries a higher risk of uterine rupture in subsequent pregnancies. To understand your incision type, start by looking at your external scar. If your visible skin scar is horizontal, it is highly probable that you had a low transverse uterine incision. If your external scar is vertical, it is possible you had a classical vertical uterine incision, but a vertical skin incision can also sometimes be made over a low transverse uterine incision. The definitive way to know your exact uterine incision type is to review your medical records or speak with your obstetrician, who performed the surgery and can confirm the details. Understanding your specific uterine incision is more than just curiosity. It is a vital piece of information, especially if you are considering another pregnancy. If you have a low transverse uterine incision, you might be a candidate for a vaginal birth after cesarean, often called a VBAC. However, a classical vertical uterine incision typically means future pregnancies will also requiring a cesarean section due to the increased risk of uterine rupture. Your doctor will use this information to help you make informed decisions about future births, ensuring the safest path for you and your baby. Knowing your C-section incision type empowers you with essential knowledge for your continued recovery and helps you plan confidently for your family's future. This small detail provides significant insight into your body's healing process and informs important medical discussions, giving you peace of mind.